that's a little gray how you worded that. So since how you characterized it, I'm not quite sure if I can really answer that part. What I can say is, since the midsummer, we did begin to see a serious uptick in the amount of tea that the herbal farmers that we actually export. And what has happened is that was all predicated upon the fact that a lot of folks were acquiring the hard care formula because it was that time of the season. But now the autumn is here, and effectively the uh, the tea formulas that's out the door now strongly is the lung care because the season that we're you address the lungs. I haven't seen the preliminary figures that Custom sent over to um, Stats, Weights, and Measures to certify. So I really can't qualify certain things just yet, but I would imagine that the parasite cleanse formula, which is like the perennial front runner in terms of how much we actually trade of all the various teas, far and away we trade more of the parasite cleanse formula, and after that, generally the detox, and to a certain extent the dieters formulas more than anything else. Um, that's on a consistent basis. But also it's the seasonal things, the heart care, the lung care, the kidney care, and the liver care, depending on what season it is. Those usually follow suit behind those first three I mentioned. So, well, where things are in terms of the colloidal silver that we trade, well, that had always been done in I would call it trace amounts. There wasn't really much that we were doing with it, because basically it was, I think you could say, those in our venue who are purveyors of it were generally just testing out their marketing models, I would imagine, and they were making it available in limited runs because it had limited capacity to meet demand. And the thing with that was, um, they were using one particular bottle back then. I'm going back several years when that was being done, and that particular bottle had a particular certification from the Department for the Health and Pharmacotherapy. As I comprehend things to be, they have changed the bottling now, and I don't know whether or not the bottling has an effect on uh, the processing and the packaging for suitable trade of the colloidal silver, but I would presume that uh, there may be some things that Health and Pharma Therapy is looking at in terms of the quality of the cleanliness of those particular bottles. They want to make sure that everything is that meets their proper standards, so that any bottle that's traded, we know is safe and secure for those who make use of the product. So, in other words, we're doing our due diligence to make sure that there is high grade quality and health is assured. So that said, in terms of the colloidal silver, as I comprehend it to be, the trade for that is probably going to be dramatically expanded, provided that the certification is acquired from the Department for the Health and Pharmacotherapy on that particular product. We'll see how it pans out. I know this much: the capacity has been enhanced, and from what I gather, more equipment's on the way, so they'll be able to increase their capacity even more. So the whole time we made the colloidal silver an option. It's just that now we have take a look at a few things differently. So in our healthcare operations, folks know that they have the essential oils, they have the herbs, and now the colloidal silver will be available in mass. So we'll be able to increase the options our folks have, particularly those inside of our healthcare plan. So that's always a good thing.